The Federal Food, Drug, and Cosmetic Act gives the FDA the authority to regulate and control medical devices. Devices that meet the FDA regulation are legal to use in the US. Does a blood refrigerator need to be listed at the FDA? What about portable fridges used to transport blood? Yes. To legally manufacture and market a blood refrigerator, it needs to meet the FDA controls regulation and be listed as legal to use. The federal regulation is Title 21, Part 864. But what is a manufacturer in CFR 21? Some might think that a refrigerator used by a clinic or a hospital to store blood does not qualify as a medical device because they don't manufacture blood. But the CFR has a very, very broad definition of manufacturer and clearly intends that anyone storing blood use an FDA-listed refrigerator, since cold storage between 1 and 6C is a manufacturer control procedure. Anyway, it is obvious that a refrigerator intended for medical purposes used to preserve blood is a medical device, regardless of where it is used. The FDA has 3 device classes with increasing risk. A blood refrigerator is a Class 2 device requiring general as well as special controls. It is viewed by the FDA as moderate to high risk to the patient. Some refrigerator manufacturers claim their unlisted product can be used to store blood, saying it is exempt from FDA regulation. This is clearly not the case. As a Class 2 device, it is only exempt from 1 of the 10 controls legally required by the CFR. It is exempt from pre-market notification, the 510(k) process. This means the FDA and the patient are trusting the manufacturer will comply with the special and general controls without pre-market verification of the FDA. However, every 2 years, the FDA will confirm that the manufacturer has current good manufacturing practices with a factory inspection. Federal law dictates that the correct blood product storage temperature is maintained. Additionally, some allowance is given for some deviation during shipping or transport. Interestingly, no maximum allowed time at the higher shipping temperature is indicated. It is left to the transporter of the blood to select an appropriate standard to follow when preparing their own blood transport protocol. Generally, a maximum of 24 hours at 1 to 10C is considered appropriate. But what if the portable refrigerator is used for transport over many days? It is appropriate to ensure the blood stays within the allowed storage range of 1 to 6 during this long duration transport. The key points of this presentation are meant to clear up some misconceptions on the legal requirements for blood refrigerators. When selecting a refrigerator for storage or transport for greater than 24 hours, check the FDA website to ensure the device is listed and the manufacturer is registered. Check to see if the manufacturer has a medical device quality management system such as ISO 13485. As a Class 2 device with special controls, it needs to have third-party safety testing to the recognized consensus standard appropriate for the device, in this case UL 61010 laboratory equipment. You might be surprised that not all marketed blood refrigerators sold in the US are legal, especially portable ones.